My wife and I would like to ask you a couple of questions.
Sure. Go ahead, shoot.
Well, for instance, what are your qualifications?
Well.
If you're a patient looking to get treated with medical marijuana, one question that always comes up is whether you're qualified to receive medical marijuana. But another important question is whether the provider is qualified to certify you for medical marijuana. And that's what I'm going to talk about today in this video.
You think I'm qualified?
Hello, I'm Dr. Michael Morgenstern, and I'm a medical marijuana provider in New York. Whether you're looking to get treated as a patient or you're a provider considering providing medical marijuana recommendations or certifications to your patients, it's important to consider what makes a provider qualified. Why is it important? Well, as a patient, can you imagine going to a surgeon for the first time and him going ahead and starting to do the surgery and starting to do the procedure, and right before you're out, he tells you, this is the first time I'm doing this? You wouldn't want that, and you don't want somebody who's not qualified to be treating you.
In Russia, I was chief of abstraction.
Abstraction?
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 Obstetrics, I think you mean.
That's it. Obstetrics? Let's hold on a moment here. Not abstraction, it's obstetrics.
As a provider, you want to be able to also do what's best for your patients, so you want to make sure that you're qualified. A few years ago, when I became aware that medical marijuana had become legalized in New York, I was really excited and interested and curious for my patients because I thought it was possible this could be something they could benefit from, especially those who are suffering from really bad chronic pain. But before I would send my patients to another provider or consider becoming a provider myself, I needed a few questions to be answered. The first was, who is qualified to do this? Could I do this myself? Do I need to send my patients somewhere else? The second question was whether or not medical marijuana was a legitimate treatment. The third was, what kind of guidelines are there? What kind of evidence is there for what the best practices are for treating patients with medical marijuana? The second and third question I'm not going to answer now, but I will in subsequent videos, so I urge you to subscribe to my channel. I plan on putting together a lot of information about medical marijuana online, so subscribe to the channel and you'll be able to see those videos as well. To determine whether or not somebody's qualified, I thought it would make sense to take a look at New York's Compassionate Care Act, which legalizes medical marijuana in New York State, and other states have similar laws enacted with similar language. What the law says is that in order to certify patients, a provider needs to be in good standing and licensed. But it doesn't stop there. It doesn't just say you need to be a physician, for example. It also says you need to be qualified to treat patients who have one or more of the serious conditions that medical marijuana is allowed to treat for in a particular state. So in New York, neuropathy, for example, was one of the original conditions. So what does the word qualified mean?
And last month, I received my new license, and now I'm able to deliver human babies.
So if you just look at the definition of the word qualified, it means competent, as by training or experience for a given purpose.
You think I'm qualified?
And I think that would vary based upon what kind of field you're looking at. For medicine in general, it requires maybe residency or additional years of training beyond just medical school that qualifies an individual to treat a particular condition.
What I mean is, can you be scary?
I know you're asking me. Can it be scary?
To determine whether I was qualified, I then looked at the conditions that were qualifying for medical marijuana treatment. At the time, there were 10 conditions. 7 of 10 were neurological conditions, things like ALS, MS, Parkinson's, neuropathy, seizure disorders. There were 3 that were not neurological conditions, though: cancer, HIV, and inflammatory bowel disease, which includes things like Crohn's disease and ulcerative colitis. So then I looked at, in states where this has been legalized in the past, people with those conditions, what do they go to a medical marijuana provider for? And it turned out that it was chronic pain. What was I treating as an outpatient neurologist? Well, mostly chronic pain, head pain, migraines, face pain, jaw pain, TMJ pain, trigeminal neuralgia pain, cervical neck pain, low back pain, hand pain, foot pain, fibromyalgia pain, interstitial cystitis pain, neuropathic pain, cancer-related pain. You name the pain, that's pretty much what I was treating, and that made up about 70% of my practice. And also cancer-related pain and abdominal pain were included in this. So I felt as though the disorders in general were amongst the type of conditions that I was qualified to treat.
Hey, Izzy, this kid says he can lift more than you can. I think you're better than me, huh?
I don't think only a neurologist would be qualified to treat these conditions, and providers need to make up their own mind as to whether this is something that they would ordinarily treat. I also don't think every single provider out there is qualified to treat these conditions. For example, is a urologist qualified to treat patients who have epilepsy? This is a copy of my license, and actually it says on it that having completed professional and other requirements, by law, I am qualified to practice medicine and surgery. Medicine and surgery. Surgery. I have never operated on anybody, so I doubt that I'm actually qualified to perform surgery. Similarly, some surgeons are not qualified to treat patients with seizure disorders. They're just not qualified because that's not what they do. Doesn't mean they couldn't figure it out, but generally speaking, most surgeons are probably not qualified to treat epileptics. Those patients are treated by neurologists.
Yes, I was head of obstetrics research at Polonsky Hospital in Leningrad, now St. Petersburg.
Ah, yes. And what brings you here then?
Well, I never get a chance to work with people in Russia.
Oh, it's more of the sort of technical side.
No, animals.
Animals?
Only rats and monkeys.
Rats?
I like a little change of scenery. I also want a patient who won't bite me.
Who's qualified or not qualified to treat patients with medical marijuana is maybe not the most straightforward question. In my practice, I treat some patients who have Crohn's disease. I'm not a GI doctor, but because they have abdominal pain and they have abdominal cramping, which is what they're coming to see me for, and I treat chronic pain, it makes sense that I can treat these conditions. At least it makes sense to me. But this is a matter of personal preference in some cases and what a particular doctor thinks they feel comfortable in and what they feel competent about. If you're a patient who's looking to get treated with medical marijuana, hopefully this video provides you some information about what qualifications your provider should have. So if you're a patient who has neuropathy and you're looking for medical marijuana, a good place to start would be to find a doctor who treats chronic pain or a neurologist who treats neuropathy, who's also approved by the state to certify patients for medical marijuana. If you're a patient with inflammatory bowel disease, the answer might be to find a gastroenterologist who also is approved by the state to provide medical marijuana certifications. On the other hand, for a provider, the answer isn't always perfectly straightforward. It might be easy for a neurologist to say, yeah, I'm qualified to treat patients in New York, but in other states, there are many more qualifying conditions, and it's possible that not every condition is treated by one particular provider. So sometimes providers might need to make judgments about whether or not they feel competent to treat a particular disorder. For example, as a neurologist, I might decide that I feel comfortable treating patients with Crohn's disease because those patients are coming to see me with abdominal pain or abdominal cramping. And so since I treat chronic pain, I might feel comfortable to do that. But I think that's a personal decision that most doctors need to make, and a personal decision for patients to see if they feel comfortable seeing a provider who might not be a GI doctor or another type of doctor that treats a particular condition who is providing medical marijuana certification.
Okay, let me get it ready for you. Just...
Run.
Thanks for watching the video. Please subscribe to my channel. And I'll be following this video up with some videos on whether or not medical marijuana is a legitimate treatment or not, and what kind of guidelines are there for providers or patients that spell out what the best practices are for treating patients with medical marijuana.